Hello, everybody, from Riccardo Matani. I'm International Sales Manager of Faro. And after the first interview between our CEO, Cristina Cesari, and the Managing Director of Benco Dental, Chuck Cohen, I have the pleasure to have here with me Ernie Verna, which is I'm reading the Northeast District Manager of Equipment Sales for Benco Dental. And I would like to introduce Ernie, giving him the possibility to introduce himself and telling us a very few things about Benco, because all of the US know who Benco is, but in Europe and the rest of the world, we as a Faro have the pleasure to know who you are, but actually not everybody knows.
Thanks, Ricardo, and thanks for having me on the interview today. I appreciate it very much. Benco Dental, largest privately owned full service distributor in the United States. We were actually founded in 1930 by Benjamin Cohen, who is the grandfather of Chuck Cohen, who was on your interview earlier. We have remained family owned throughout the three generations of leadership here. And our headquarters are in Pittston, Pennsylvania, which is in Northeast Pennsylvania, but we serve dental professionals just across the United States. We do have 5 large distribution centers and 3 Centerpoint showrooms, also across the United States to help serve those professionals. As far as myself, I have been with Benco for 16 years. I have been in the dental business for over 50. All of it pretty much on the equipment side of the business. So thanks again for having me on. I appreciate it very much.
It's a pleasure, Ernie. I had the chance to meet you a few times in the U.S. and one of those times were in Texas, where you had a BSF, was very nice to participate as well. And I can confirm also I visited the Pennsylvania headquarters. Is amazing. You had a lot of things out, and I can understand why you are one of the main leaders in the U.S. market for dentistry. So it's a pleasure to have you here and to have your experience shared with us to understand a little bit more what's going on in the U.S. So concerning this point, I would like to say that we all appreciate if you could share with us some of your perception around the trends that are in the U.S. at the moment in dentistry. So what's your thoughts about, let's say, the main trends in the U.S. markets for dentistry? I don't know if there is something more oriented to technologies like digital and disinfection or stuff like that, something that we know also here in Europe is very growing.
Yeah. Well, you said it, technology. Technology is probably the #1 trend that I'm seeing right now. And it's incredible how quickly that market has grown, that piece of the dental market. The dental market itself has grown in leaps and bounds, but the technology side of the market has grown even greater. And it's funny, when I think back, Ricardo, I think in the 50 years that I've been in this dental business, I've gone from dip tanks to digital sensors. I've gone from film-based 2D pans to digital 3D cone beam units now, and belt-driven handpieces to electric handpieces, and now to hard tissue lasers. It's rare to visit an office these days that doesn't have that kind of technology in place. And CAD CAM, don't even get me started with CAD CAM, same day crowns and 3D printing. There's no way when I first got in this business, I would ever dream of being here. Technology has impacted dentistry across the board, and I'm really excited to see where it's going. The other thing that I'll mention is patient experience and the focus on patient experience. This is where we've gone from the primitive foot pump chairs to ultra leather upholstery and patient controlled heat and massage. I mean, We've gone from analog trays and impression material to digital impressioning. So a lot of progress in the area of patient experience. I remember back in the mid 70s when there was a Dr. James Pride who actually came up with the idea of a dual entry operatory, where he literally put all of the instrumentation behind the head of the patient. The patient would come in, walk right past all the instruments, not even seeing them, and sit down in a chair facing a window and really seeing nothing but a beautiful view out the window and maybe the overhead light. That operatory design is still in use today and still very, very popular and efficient, I might add. So the other thing that you mentioned, I think, was infection control. A lot of growth over the years in that area. Again, I remember, I'm going to go back a lot. So a lot of times we don't realize how fast we're moving until we look back at where we were. So back in the early 80s, I was living in Florida, working for a company called Benco Dental Supply. Back in the early 80s, gloves and masks were rarely ever used in an office. I even had one doctor down in Orlando that actually smoked cigarettes while he was working on patients. He would lay the cigarette up on the x-ray control box in the hallway and go in and work on a patient. This was the early 80s. This was not a long time ago. And then in the late 80s, when 6 patients contracted AIDS, also down in Florida in a dental office, the entire dental world changed as we know it. So everybody then was thinking about infection control, the doctors, the patients, and the government. So, and when we thought we had it all figured out, years later, COVID hits and took all of it to a new, entirely different level. So, but it's interesting, over a period of time, the sterilization area moved from kind of like a dingy back room space to now being front and center within an office. So a lot of practices are even showcasing those sterilization areas so the patients feel more secure and comfortable with their protection. So, a lot of things trending, a lot of positive stuff happening. Yes.
Yeah, I guess you touch some very interesting points, especially when we talk about sterilizers. And I saw all these autoclaves and everything also in different countries worldwide. So it's not only in the US that the doctors are willing to share their attention to sterilization, and so the attention to the patient at the end. So it's very interesting and very common also in this part of the ocean. By the way, is there a way that you can determine how Benco has become that popular in the US? Because I have some ideas since I met you and all the management, so I have clear in my mind why you are so good in business you're doing. But from your point of view, what are the main factors that are making Benco one of the leading companies in the US?
That's a great question. And it's actually easily answered by just kind of sharing our mission statement with you. And that is that we drive dentistry forward through our innovative solutions and caring family culture. The caring people and the family culture that we have are paramount at Benco. All of us at Benco, from the senior leadership team to those who pick the orders and ship out the boxes, all of us at Benco strive to provide that personalized support to dental practices to help them succeed. And that helps keep our partnerships healthy. And by focusing on those partnerships and relationships, we build trust and loyalty within the industry. I mean, obviously, it's an individual thing, but I also think it's something that filters down from the top to the bottom. And I think it's a wonderful thing. It's one of the reasons why I love being at Benco. And I've been saying this for quite a few years now, especially lately, in an environment that's slowly becoming more and more transactional. We're still focusing on the value of being relational. And I think that's key. So the other thing I think that sets us apart is the incredibly experienced sales force that we have. I said that in a certain way. I didn't want people to feel like all we had were old salespeople. We don't. We have quite a few tenured salespeople, but we also have young salespeople eager to learn, and those tenured salespeople are willing to mentor, which I think is a positive thing in any company. So I think the knowledge and experience that we have on our team is second to none, and we never stop learning. All of us. If we want to stay relevant and successful in this business, we have to keep learning. That's true for the rookie rep. It's true for tenured people like myself. You need to stay on top of your game. So I'm also proud to say that at Benco, we're all about choice. And I think that sets us up as well for success. We have a very, very wide array of equipment options and basic core equipment to technology. And we do take time to review all of those options with our customers. We'll obviously make recommendations if we're asked to. Certainly you want to pick our brain. But at the end of the day, it's really what the customer wants that matters to us. So yeah, I'd say our people, our culture, the fact that we're all about choice. I think that's part of what sets us up for success.
Yeah, I can confirm everything you said because I met different equipment specialists from Benco and all of the guys and ladies that had the chance to pass by our booths or had the chance to meet us here and there. They all showed us the will to understand what we were talking about and the big advantages that FARO could bring to Benco as a company and as a business. All of them very curious, and therefore I have to say, yeah, all the Benco people are very driven to learn and bring the best to their customers. So that's 100% true. And if we think about this relationship that we created in the last 2 years, as far as a leading company in dental lights, what is your experience in these 50 years in the US concerning especially the perception that the doctors have of the light that they should have in their clinics to have the best performance possible, to have also the best light for their health, for the good of their eyes and their overall well-being, and also for the patient, of course. So what is your idea in these years? What kind of development have been past these years?
Yeah, it's interesting that you bring this up. Lighting has become more and more important to me. I think, as many of us know, as we get older, more and more light is needed in order for us to properly see, right? It's one of the reasons why older people like me don't like driving at night. We need more light. And I do think that operatory lighting in general is often overlooked, maybe even ignored. It's just not considered. Everybody makes an assumption that they just need to get a dental light, to put over the patient, and that's all they really need. I don't know that they really consider the optimal lighting setup in an operatory overall. I remember quite a few years back when you may have heard of the company Pelton and Crane. I remember when Pelton and Crane was popular. Back then, the light reflectors had a tendency to deteriorate over a period of time. And as they deteriorated, the light that was actually hitting the patient would turn more and more blue and then purple and then literally not even be there, to the point where there was barely any light hitting the oral cavity. And since it happened over a progression of time, the doctor never really noticed it. And there were times when I would walk into an office and I would hold a white piece of paper up against the headrest, shine the light on it, and show the doctor that it was hardly even lit up. and they would just raise their eyebrows, and right away they'd be looking at replacing the reflector or replacing the light. So nowadays, a lot of clinicians are moving away from halogen operatory lights. There are very few, if any, are even being sold anymore, and everything is moving to LEDs, which I think is a positive thing. But while they're upgrading their lights in the operatories, okay, there is still little attention being given to the ambient room lighting. So, I mean, you think of it this way: if you upgrade the older halogen lights with brighter LED lights, and you leave your old 2x4 fluorescent fixture sitting in the room, your stress from moving from lighted areas, bright areas like the oral cavity, to the countertop, going back and forth and back and forth, your eyes are having to adjust every time there's that movement. Just moving from the patient's oral cavity to the instrument tray, your eyes adjust. It's minute, that adjustment, but it takes its toll. So I even have some offices where the doctors are opting out of overhead dedicated dental lights, and they are just going with lighted loops. And while that works for them, and I don't see a problem with that, when they move away from the patient and turn to the countertop or something like that, I think it's even more critical that the ambient lighting in the room is brought to proper levels to keep your eyes from fatiguing. Headaches, migraines, the whole 9 yards there. So I think that's part of it. I do think that by and large, a lot of doctors really only care about the operatory light, the dental light, and not necessarily about the ambient light in the room. And that's a concern.
Yeah, this is also a good point, because you pointed out the importance of the intensity of the light between the operatory light and the ambient light, which is very stressful, as you said, passage from when you're driving into the tunnel and then suddenly you go back into the sun. The eyes need to make a big effort to adjust to a new light intensity, and this is stressful if you consider that you're doing that for the whole day. So it's an important point. And at the same time, you said right, the LEDs came to the market, and that's a good thing for different reasons. But at the same time, we must be sure that we're using the good LEDs, because also wrong LEDs can cause this stress on the eyes if they're not properly reproducing the colors as they're supposed to be seen. So having a good LED allows you to avoid stress on your eyes by moving to something that you used to know as supposed to be that color to something that is actually not that color. So it's really important to have also a good LED quality together with the intensity balance of the illumination inside the clinic. So this is why we decided to come to US with the two light together, the operatory light and the seating, the ambient light seat area, and the operatory light EVA. EVA then that come also with the camera, comes also available with the camera integrated, can be with or without it. But now the trend, as we said before, in technology is to go towards this possibility as well. So I would like to know, from your point of view, what are the features that are more giving the wow effect to the doctors or the equipment specialists from S.p.A and from EvaCam?
Yeah, something I want to answer your question. The one thing that hit me while you were talking was I had lunch yesterday with a colleague, and we happened to be in a dark restaurant. And when we walked out the front door, the sun was shining, and I could hardly see. So that adjustment, even though it was a large, vast adjustment, a wide adjustment, is typical of what you would see in an operatory when you move from a lighted area to a darker area. So
this happens also with the color match. When you doctors are taking the color matching with the tooth. It's happening also in the shops when you go and buy some clothes. Under the wrong LED, you see, let's see, this jacket is blue, but under the sun outside, you see a different color.
Yes.
So this means that the LEDs you had in the shop were not that good. So you also have this to take in consideration by having the right LED in your dental clinic, especially when you take the color matching for the teeth, and also see the gums and the blood and tissues and all these important things for doctors. So exactly, the two things are going together in parallel.
Yes, for sure. And I mean, I remember the day when, the doctor used to ask the patient to get up out of the chair and walk over to the window, and they would hold it,
It's a classic, yes.
and look outside. But, again, it depends on the light that's actually hitting you. So I agree. Back to your lights, when I first saw the Sedaria light at the Greater New York meeting last year, I was literally blown away, and I saw right away an immediate application for it. I have seen over a period of time, I've seen a lot of ortho and pedo practices who have opted out of dental lights and have just paid an electrician to put a very large, high intensity, usually a halogen light, directly over the patient's head when they're reclined in the chair. Most of these lights are not color corrected. Most of them have a very, very harsh glare to them, so much so that the patient has to usually wear sunglasses. But it lights up the oral cavity. But again, we get back to that patient comfort thing, right? So I looked at your light and I thought right away, you could place a single Sedaria light above the patient, and it would give dimmable, color corrected light, all that they would need, okay, without all the glare. The other day I was looking at your flyer on the Sedaria, and I'll be very honest. I mentioned earlier about staying on your game and how important that is, but some of the metrics and the details that you provide on your flyer, I actually had to look some of these terms up to find out what they meant. And I'm glad I did, because when I did, I found out that your color fidelity, the saturation, and the glare ratings that the Sedaria have, your light takes operatory lighting to a new level. Okay. I think it's a game changer. I know that's kind of a cliche, but I do think it's something that it's a resource that's really been untapped. Your Eva Cam light also caught my eye. We actually had that in our booth. I'm hoping we have it in our booth again this year. But I thought it was a great idea, incorporating a 4K high resolution light, a camera into the light. And I thought it was a great idea. And it takes standard MP4 videos and JPEG images that can be downloaded and used over and over again. So I think it's a great light. It also uses reflector technology, which limits the amount of shadows that the clinician would see. I mean, what more would you need in an operatory light, right? So, yeah, very impressed with your lights. Obvious to me that you spend a lot of time in research and development, based upon what I'm seeing in the literature. So kudos to you all.
Yes, thanks for pointing out also some good features of EvaCam. Regarding Sedaria, you said everything perfectly. You know the argument very well. The light itself is, as you said, has a treatment on the surface to avoid the glaring of the patient and the doctor, of course, or the assistant. So it's called a UGR, which is the ratio that must be respected as European regulation to avoid the glaring on the patient's eyes. And we are far below the requirements. So the treatment that we did on the surface is on this purpose. And regarding the balance also of the illumination, you know that Sideria gives the light also on the upper part of the light, so that also the walls are covered with light and you don't have the dark areas in the surroundings. So it's very important for the health of the doctor's eyes. Concerning the EvaCam, you said correctly. The light itself does 90% of the job, because you can ask any photographer, without the good light, the photos are not that good. So this is why it's important to have good light, but as well, we produce this light with an integrated 4K camera that allows the doctors to take pictures exactly in the moment they need it, without taking the time to remove the gloves or ask the assistant to take the picture from a different angle. So actually with the EvaCam, you can take pictures or record videos exactly where you're pointing at. So this is the most important thing for us also, together with the fact that you can easily use it. So we created a product that must be easy to use for the doctor. He doesn't have to think about how to use it. He just needs to use it when he needs. So we are 100% sure that the US market is ready for these products, and more and more doctors are asking for products like this, and we are confident that more and more will come in the next month and in the next years, especially the new generation. We're more familiar with technologies.
Yeah, and as the word gets out, one of the things that I've kind of tuned in on when I looked at your flyer on this, and when I saw it in New York on the Sideria, is that it puts off an ambient light, what I'm going to call an ambient light that faces upward. So it illuminates the room, but it also illuminates the patient. And I did not know originally that there's two different color temperatures for the upper light and the lower light. Can you explain that a little bit, like what the difference is there?
That's correct. We want to provide on the walls and the circulation area a warmer light for the comfort of the patient and the doctor and the assistants, while we need a more professional and specific light for the operating area. So where the doctor operates, he needs to have 5,000 Kelvin degrees to have all the colors and the best response from the surfaces that the light is hitting. On the other hand, having the upper part of the light projecting a warmer light provides a more comfortable vision for the doctors and the patient. So it's creating a sort of a comfort zone around the dental chair.
Good.
So we are now heading fastly to the next New York exhibition, and it seems if my mind assists me, is the 100-year celebration of the New York Dental Meeting. What is your expectation on this show? I will be there with the CEO, and I hope to see you there as well. But what are your thoughts about this show that is up to come?
Well, with the New York meeting being the 100th anniversary, I have a feeling it's going to be pretty busy this year. There's been a little bit of a slowdown over the years in meeting attendance, but I do expect this meeting to be pretty well attended. And as I do every year, I love to reconnect and network with a lot of my colleagues, walk around and catch up with many of them. I think that's one of the great benefits of going to these meetings. The other thing that's exciting is to actually be in the booth and have visitors come by the booth and look at things that they otherwise would not know anything about. So I'm hopeful this year that your light will be in our booth. And that you will be in our booth at some point, stopping in to say hello. I'm sure you will. But I will be very excited to see customers come and take a look at the lighting there that you guys provide. I also like at the New York show, I take the time to walk around and look at the other equipment that's coming out, the newer equipment that appears to be, just kind of hitting the market, just to get my mind around what's coming. So the New York meeting is one of the big ones, and I don't think it's going to disappoint this year. I think it's going to be very well attended, a very successful meeting for all of us.
Yeah, I think the same. We're very thrilled to be participating there. We will pass by for sure to Benco booth to say hello and see good old friends that we started to know each other not so far ago, but still looks like we have been doing through some very interesting things in these 2 years. So definitely would be a chance to strengthen our partnership that we built up in the last years. And what's your expectation for the future? What do you see in the next years concerning the cooperation between Faro and Benco?
Well, and one of the things that is a basis for us is the idea of innovation. And we love new innovative products, especially when they come from quality vendors such as yourselves. That focus on innovation is shared by both of our companies, obviously. So I see that propelling us forward together. You're going to continue to innovate your product line. I'm certain of it. We will continually be looking for innovative products to represent and bring forward to the dental community. So I think our collaboration is going to hopefully result in increased excitement on the part of the doctors to improve their practices and the patient experiences.
That's amazing. This is exactly what I wanted to share with you. It's exactly the same feeling. We want to bring you as much technology as we can to bring it to the doctors in the U.S. market. We are very thrilled to have this partnership with Benco. We are honored to have this opportunity to develop Faro brand in the U.S. because we have been not we weren't present with the dealer before, but we strongly wanted to have Benco as a partner for this reason, for innovation, technology, and people, most of all. Yes. So I wanted to thank you, Ernie, for your time. It was a friendly call. It was a friendly talk, and I appreciate that we share some of our point of view on different topics. I am very happy that if I will be able to see you in New York, and I wanted also to say thank you to the people that take some time to look at this video, to this format, and wishing all the best to you and all of the people that will join us in New York show and will see this video. So thank you to everybody and see you very soon. I don't know, Ernie, you want to say something?
No, thank you so much for inviting me to spend this time. I really do appreciate it. And I am for sure looking forward to catching up with you at New York. So thanks again.
Thank you so much. A very big hug from Italy. Ciao.